If your knee feels stiff, swollen, and hard to bend after surgery, this is the first exercise you need to be doing, and most people tend to skip it or don't know that they need it. I'm Dr. Dominic Rangel. I'm a physical therapist here in San Antonio, and I help people rebuild strength and confidence after knee surgery. Right after surgery, your number one goal is simple: get the knee moving again, and bending it, called flexion, is the key to walking, sitting, and completing stairs negotiation. But your body wants to protect the knee, and that leads to stiffness quickly. Your body's in that protection mode, and we have to override that a little bit. This is where we insert the heel slides exercise. It's the bread and butter for knee motion. You can do it while you're in bed, you can do it while you're sitting, you can do it while you're on the couch, on the floor, but I don't recommend getting on the floor right after surgery. But here's how you do it right. First, you start by laying on your back with your legs out straight and totally get relaxed. 2, slowly bend your surgical leg and drag your heel up towards your butt as far as you can without a significant sharp pain. You're going to hold that position for 3 to 5 seconds, then you're going to straighten your leg out again. We're going to do somewhere around 10 to 15 reps early on, bumping that up to 30 reps as you get better and better at it. And yes, it should feel tight and a little bit uncomfortable. If you aren't working at it, then it won't get better. Trust me, I see it all the time. Patients are waiting, they're hoping that the time is going to make it feel better, and then it's going to start to bend by itself. That's not how it works. Here are a couple of the progressions and modifications that we use. So like if you're sliding it and it's too hard, you can use a towel, a yoga strap, or a stretch belt, right? You can use a towel on a table, you can use the towel on top of a slide board, use a yoga strap to pull your knee or your foot a little bit harder for bending it. You can use a stretch belt. Same reason. I'll link the one that I use in the description. If it's too easy, you can try doing it while you're in sitting, or you can slide your foot down on top of a wall. The big thing that you want to avoid whenever you're working on bending your knee is you don't want to force it to the point of sharp pain. Some pressure is normal, but stabbing pain, it means you need to back off a little bit and avoid bouncing or jerking the knee around while you're trying to bend it. So let's recap really quick. Heel slides should be the first thing that you do to start bending your knee after a surgery. Do them multiple times a day. Go slow, keep track of how far you're getting. If you're stuck or worried, your range of motion isn't improving, you've plateaued and it's not getting any better, let's go ahead and build a plan together. The info to contact me is in the description.